Turning to COVID-19 statistics today, we had a challenge with our server because of power outages, but nonetheless, we still managed to test some 1,205 samples, out of which 189 people have tested positive in the last 24 hours. Thus, we have now 10,294 people who have now tested positive in the country. This pushes our cumulative figures to 216,242. 106 of those are male, when 83 are female. Or the youngest is 5 and the oldest is 71. Nairobi continues to have the higher figures, recording 147, Kiambu at 20, Machakos 11, Kajiado 5, Mombasa 2. Obviously, because of the challenges that we had, it means that we are holding samples that we have not tested in the last 24 hours. And these things happen. As you will remember, yesterday we had the highest figure at over 7,000 tests. The distribution of these cases in terms of sub-counties, especially for Nairobi, are that Dagoretti North has 77 cases. Embakasi East has 10, Madaraka has 10, Embakasi South has 9, Kibra has 9, Embakasi West 6, Langata 4, Kamukunji and Kasarani all have recorded cases. And in Kiambu, the 20 cases come from Kikuyu, and 2 cases. Machakos have 11, mainly in the Athi River area, and in fact in a place as far as Masinga has now recorded cases. Gatundu South, Irunguri, Juja, Rimuru have all got a case now. In Kajiado North has 4 cases. At the same time, I'm glad to inform you that 65 patients have been discharged from various hospitals, bringing the total to close to 3,000 at 2,946, the number of recoveries in the country so far. However, today, I'm also saddened to inform you that we have lost one of the higher numbers at 12. 12 patients have died as a result of COVID-19. All the 12 are here in Nairobi. 3 of the cases actually died at home, and the rest of them are in the various hospitals, which tells you, ladies and gentlemen, that the people being affected are more, as expected. As you can see, the patient's age is across the board, and all these deaths are from essentially community-based deaths. And this is the highest number of fatalities that we have recorded in a single day. That is not good news, and our condolences go to the families of those who have lost loved ones. One of the biggest challenges is logistics support, including transport for the county and some county teams. Ladies and gentlemen, today, as we continue the fight, I'm delighted that the contact tracing team is receiving a major boost from our development partners. It is my pleasure to preside the handover ceremony and distribution of rapid response vehicles to various counties. These vehicles have been procured by the COVID-19 Health Emergency Response Project in my ministry at a cost of some 200 million shillings. Transport has been one of the key challenges identified, especially in accessing the rural areas as the government works at providing quality health care. These vehicles, to be handed over to 13 counties, will boost capacity in contact tracing and surveillance as we work to curtail the spread of the virus in the country. The counties identified to benefit from this support include Nairobi, which will get some 2 vehicles, one for Kenyatta National Hospital and the other for the newly formed Nairobi Metropolitan Services. Others are Mombasa, Kiambu, Kajiado, Machakos, Nyeri, Migori, Busia, Uasin Gishu, Nakuru, Taita Taveta, Elgeyo Marakwet, and Kisii. The overall project and the outcomes are designed to assist counties to prevent, detect, and respond to the threat posed by COVID-19, and then to strengthen the national system for public health preparedness and responsiveness. The project was selected for COVID-19 financing because of the strategic place Kenya holds when it comes to global connectivity and travel and the risks posed. The project is provided through the World Bank Group Fast Track Facility as part of the global COVID-19 multi-phase program approach. Now, the information is this: there is COVID-19. Even a little kid in the streets of Nairobi is now singing that they can get it, and you can get it, and we can all get it. Even small children, you listen, they'll be telling you. Who are those other people who we are now told don't know that there is COVID-19? And how long do you think it will take for them to actually know that there is a COVID-19? So as far as I'm concerned, if somebody is in denial, there is not very much that you can do. One of these days, that denial will disappear very fast. Because even some of the ones that we have been told, even nations, even countries have told us that they are in denial, that there is a COVID-19. There are some countries that actually declared there was nothing like COVID-19. But very big people there died of COVID-19. If you go to the same places now, nobody is in denial. So we don't want to have a situation where it is only after we die that we cease to be in denial. I think you can help them. You are the media.
Those that are jumping from hospital to hospital, seeking testing, you know there is a clamor for everyone to get tested because it is wrong that the attitude is not there. Kenyans are actually scared now, and everyone is seeking to be tested. But the way they are seeking to be tested is also wrong, because our testing strategy, on the other hand, is different. It is not asking everyone, let me test you, or that anyone comes, I want a test. We cannot afford that. CS has just said it's fair and expensive exercise. So we have drawn out a new strategy, according to targeted, more focused targeted testing, and it's going to be more syndromic. We are starting mainly with those who are symptomatic, and this will be coming from the alerts that we are receiving from the communities. And at the time that the alerts are sent, then we send rapid response teams to where the individual is. So we don't want individuals jumping from homes to every other hospital. We are spreading the infection even further. And even those who are following those 7, you are establishing yourselves as contacts already. So we want those that have symptoms to call the same number, 719, and a rapid response will be coming to you and will be tested from site. And as the CS has said here, that testing is free. So those who are jumping, looking for testing in Kenyatta and being charged 5,000, they should have called the RRT team, the rapid response teams. Testing was going to be free. We're also focusing, of course, on healthcare workers. And again, for the healthcare workers, we want to focus mainly on those who are symptomatic. While we are doing contact tracing, we follow up those that have had contacts with those suspected cases and contacts with the healthcare workers. Again, we are prioritizing this for our testing. So our testing strategy, which is being rolled out as we speak, has clear details and priorities of who we are testing. Where mass testing comes in is when we establish that a certain locality is establishing itself as a cluster of positive cases. We would want to go and test the people there. Most of those have symptoms and close contacts, and if possible then ring fence that area to contain that infection.
Wewe photographer, toka. Kisii. Watu wa Kisii. Haya. Ndio wapi? Mombasa. Mombasa County. Ini ya wapi haina mwenyewe.